In this section, we will talk about one of the leg bones, known as the tibia. The tibia is one of the vital bones of the leg. Unlike the other bone called the fibula, the tibia is the weight-bearing bone and forms joints with the femur and bones of the foot. The tibia is the major weight-bearing bone. It helps to maintain body alignment because it articulates with a non-weight-bearing bone, fibula, at the tibiofibular joints. So, it is the stronger of the two, helping us to walk, stand and run. It comes second after the femur in being the longest and the largest bone of the vertebrate skeleton. The strength of the tibia bone is also due to some of the powerful muscles attached to it. Now let's talk about the features of the bone. As you can see, it is in the lower leg of the human body. It is situated between the two major joints, the knee joint formed by the tibia with the patella and femur, and the ankle joint is formed by the tibia with fibula and tarsals. The tibia positions itself parallel and medially to the fibula bone in the lower limb. Present slightly in front of the fibula, the anterior part of the lower leg is named as shin, and the major portion of the lower limb is occupied by the tibia. While looking at the bone, we can see that it can be divided into three main parts. The upper part, which contributes to the formation of the knee joint, is also called as the proximal or upper end. The shaft lies in the middle of the two extremes, the upper part and the lower part, and is the site of various muscle attachments. The lower part takes part in forming the ankle joint and is also named as distal or lower end. The proximal end is the upper portion of the tibia. It is slightly larger in size than the distal part. The upper end contains four important bony features: the medial condyle and the lateral condyle, the intercondylar fossa, the tibial tuberosity. Let's look at the two condyles of the tibia first. Here you can see the highlighted expanded part of the proximal end. This is the medial condyle. Medial condyle is larger than the lateral condyle. Its superior surface articulates with the medial condyle of the femur. The lateral condyle is shown here. It overhangs the shaft more than the medial condyle. The superior surface of the condyle articulates with the lateral condyle of the femur. On the lateral condyle, a tubercle called the Gerdy's tubercle can be seen. This is a site where the iliotibial tract band attaches. The medial and lateral condyles' articular surfaces are visible when viewing the proximal end from a superior angle. In between the two condyles present the intercondylar fossa, as shown here. The intercondylar eminence is located between these two fossas. The anterior and posterior intercondylar regions are separated by this eminence. The fourth structure of the upper end that we will talk about is the tibial tuberosity. Tuberosity of the tibia is a prominence located on the anterior aspect of the upper end of the tibia. It forms the anterior limits of the intercondylar area. It provides a connection to the patellar ligament. It is also used to identify the site of the tibia bone. Now let's look at the shaft of the tibial bone. The shaft of the shin bone is triangular. It contains three surfaces: medial surface, lateral surface, and posterior surface. Three borders: anterior border, medial border, and interosseous border. As previously said, the tibia's shaft is triangular. To further comprehend this, let's look at this triangle and assume that it represents the tibia's cross-section view. The three corners of this triangle correspond to each border, and in between the two borders, surfaces are present. Between the anterior and lateral border, the lateral surface is situated because that faces laterally. The medial surface is sandwiched between the anterior and medial border. The posterior surface lies between the medial and the lateral border. Important landmarks can be found on the posterior surface. Here you can see a line. It is named as soleal line. Soleus muscle is attached here. Above the soleal line is a triangular area which provides attachment to the popliteus muscle. And below this line, the presence of a vertical ridge gives attachment to the flexor digitorum longus. Let's look at the lower or distal end of the tibia now. The distal end contains 5 surfaces: anterior surface, posterior surface, medial surface, lateral surface, and inferior surface. Out of these 5 surfaces, 2 are extremely important to remember. The medial surface has a significant bony landmark, as mentioned earlier, the medial malleolus. The lateral surface, which contains a fibular notch, is the spot where the interosseous membrane present between the tibia and fibula is thickened and involved in making the distal inferior tibiofibular joint. As for the inferior surface, just like the posterior surface of lateral and medial condyles of the upper end, it is also articular. The inferior surface of the lower end articulates with the talus bone of the foot, involved in the foot joint. Now that you have understood the bone features of the tibia, it would be easier to understand its anatomical position. If you look at the bone, the upper part is big and expanded than the lower part. You will feel a rough bony projection at the anterior aspect of the upper end known as the tibial tuberosity. The medial side of the lower end extends a little downwards than the lateral side. This extension is the major landmark of the human body, which is known as the medial malleolus. If you hold a tibia in your hand, on the lower portion, if the medial malleolus is on your left side, and at the same time, on the upper side, the tibial tuberosity is at the front. This means that you are holding a right-sided tibia. Now if we look at the muscular attachments at the tibial bone. The first muscle is the sartorius, which is attached at the medial surface of the upper end. The gracilis muscle is attached a little lateral to the sartorius muscle. Distal to the gracilis muscle is present the semitendinosus muscle. All these 3 muscles of the upper end are called pes ansernis. The quadriceps femoris muscle is attached to tibial tuberosity via a patellar ligament. The tibialis anterior muscle is attached to the lateral surface of the shaft. Now coming toward the posterior aspect. The first muscle is the semitendinosus muscle present on the media condyle of the tibia. Next is the popliteus muscle present on the posterior surface of the shaft. The soleus muscle attaches to soleal line. The tibialis posterior muscle attaches to the posterior surface. A ridge is present on the shaft of the tibia to which the flexor digitorum longus muscle attaches. Peroneus longus attaches to the lateral condyle of the tibia, however, it is mainly originated from the fibula. The extensor is originated from the lateral condyle of the tibia. As you can see, there are 6 muscles that have insertion sites at the tibia bone. You can remember the names of these muscles with the help of a mnemonic. They provide good quality services. Where each capitalized word is associated with the first letter of the muscles attached here. P is for popliteus muscle. G is for gracilis muscle. Q is for quadriceps femoris. S is for sartorius muscle. And the double S here is for semimembranosus and semitendinosus. On the other hand, there are 6 muscles that are originated from the tibia bone. The mnemonic for muscles which are originated from the tibia is: please educate these 3 sweet fellas. Each first letter of the words of this mnemonic corresponds to a muscle name to remember them easily. P is for peroneus longus. E is for extensor digitorum longus. T is for tibialis anterior. Second T is for tibialis posterior. S is for soleus muscle. And F is for flexor digitorum longus.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.